After a stressful and isolating 2 years, many people have returned to the office or school, but not everything has returned to how it was. 71% of employers reported supporting mental health well or very well in a McKinsey study, yet only 21% of employees agreed. That's a huge difference. So how can you make perception a reality? Wilfred Kren is a licensed clinical therapist joining us now via Zoom. Wilfred, thank you for being here.
Jeff, thank you so much for having us. It seems like you can't go anywhere these days without hearing about some crisis in the workplace. First it was COVID, then the Great Resignation, mass layoffs, and now people are talking about quiet quitting. And that takes a toll on our collective mental health. And COVID really forced us to sort of build a new normal when it comes to mental health. And I think people are starting to realize that taking care of mental health is not an option anymore. And employers, for better or worse, we think for better, are a driving factor in this.
What are some of the
Yeah, go ahead.
What are some of the top concerns specifically? We saw that discrepancy gap between what employers and employees think. So what are some of the top concerns you're hearing about or from employees and from employers?
Absolutely. Before we started Mentera, we talked to HR, we did our research across industries, and we learned that employers know that there's a mental health crisis out there and they care about their employees' mental health, but the message that they want to support that doesn't always come through, hence that big gap. And I think what we're noticing is that maybe what people are offering aren't really meeting the new needs that people are really experiencing, especially as more and more people start to care about taking care of their mental health.
It appears there can be a methodical approach now that employers can start to take, something called the care stack. What is it and what are the facets of it?
Yeah, so HR at companies are not therapists. We're not asking them to be, but they do need to know what's available. And so we created this concept of the care stack as a way for them to start thinking differently about how they support their employees. Start to think about the different needs. I mean, people who worked in tech, you know about the idea of a tech stack, a different solution for every business need. We want people to start prioritizing their employee mental health in the same way and make sure no matter if you are suffering from suicidal thoughts or just trying to manage your stress better, that there's a solution out there for you.
And if people want to learn more about the care stack, whether that's professionals or the employees and employers, there's an opportunity coming up.
Absolutely. So next week, we're bringing together HR professionals, managers, really anyone who's passionate about mental health in the workplace together for what we're calling the Care Stack Summit. It's going to be both virtual, and for those in the Twin Cities, we're going to have a special in-person meetup in Minneapolis at the Hewing Hotel with our partner, Learn to Live, on October 13th. And so that's really what we're going to break down. We're going to bring in stories from people all over who are experiencing mental health in different ways and talk to some of the solutions out there that companies can partner with to start to provide that support.
Well, Wilfred, I appreciate you having some time for us. We're going to put that graphic up again so everybody knows. The Care Stack Summit runs from October 11th through the 14th in Minneapolis. Sessions, as he said, are both in person and virtual. And the key part here that's important, I think, is registration is free. We've put the additional details on our website. Thank you again, Wilfred, for joining us on a very important topic for the workplace nowadays.
Thank you so much for having me.